When a patient complains of pain or discomfort in the sacroiliac area, there may of course be problems in that area, but commonly pain is being referred from elsewhere in the back or even in the abdomen. Drag palpation in this area suggests quite a lot of hydrosis, increased sympathetic activity, which may relate to a trigger point. If I press in there, does it hurt?
Yes.
Is it local or is it spreading at all?
It's spreading downwards.
Downwards how far? To the...
Right to my buttock.
Okay. So we have an active trigger point, and this is something familiar to you. You recognize that pain?
Yeah.
Okay. So some of your back pain may be coming from up here.
Okay.
I'm going to press on that, as I've just done, for about 5 seconds, and then ease off, as I've just done, and I'm going to go on repeating that until you tell me that the pain is changing. And I'll just keep going on and off, and you report back to me. Still the same? It could take a number of repetitions before it begins to change.
That's it beginning to change.
Is it changing locally or down here in the lower back?
Both, I think.
Okay. And is that change a reduction or an increase in pain?
Reduction,
Okay.
yeah.
I'm going to mark that point just for a second. I can find my marker pencil. Having marked that point, I'm going to ask you to do something a little different. I'm going to compress the point, and I'm going to position your pelvis or leg, and I want you to tell me if the pain changes. Firstly, if I'm pressing there, you feel the pain. Okay, what's the score now out of 10?
It's gone down a lot.
Number?
4.
Okay, we'll try a slightly different approach. I'll just get my hand under your knee. Okay, you feel the pain again.
Yeah.
That's a 10. What's the score now?
Just 2.
Okay. Now, I want to get a contraction right where that trigger point is, where my thumb's touching you. To do that, you're going to have to hold this position without my hand supporting your leg. Can you sort of just do that? Beautifully contracted, lovely. You're going to hold that for a few more seconds, and now put your leg down. And can you bring your right arm so that it's lying alongside your face? That's it. I want you to slowly now begin to stretch your right arm away from you, making it longer, 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 longer. Lovely. And now your right leg, I'd like you to stretch that away from you. Stretch, 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 stretch. And now relax both your arm and your leg, and we've got a nice stretch into those tissues. Is that tolerable? Is it comfortable? Okay. So we're stretching the local tissues in which the trigger point is housed, and we'll hold that until the tissues begin to lengthen, which they're doing now. And we're going to now do a different contraction, where you try and bring your lower ribs down towards your hip, down against my hand, and your hip up against my hand towards your ribs. So we're getting a general contraction of the whole muscle area. And release it and relax it. And again, stretch your right arm away, lengthening, lengthening, and your right leg as well. Okay, and relax now. And just let me hold the whole muscle at stretch. Is that hurting you at all?
No, it's okay.
Okay, and this we should hold for a good 30 seconds to get some length. It's hard to tell which muscles are involved here because there's no way of knowing how deep the trigger point was. But generally stretching and lengthening. And then I'll give you some exercises to do at home where you do some self-stretching.
Okay.
Okay. And we'll release it. I'm going to go back and press it again. It'll probably still be tender, but it should be less so, or it often is. Is it still as painful?
No, it's slightly less.
Is it referring down still?
No, but a little
Okay.
less.
This may be tender for a day or so. I don't want you to do any active exercise, no digging of gardens, no playing tennis. Let this rest for a day or so. And maybe when you get home, you get a hot towel and rest it on there for a while and do some very gentle movement and stretching, but nothing else.
Okay.
Okay.
Thanks.